Hi, this is Jessica DaMassa, and I am here at Health Datapalooza. And joining me right now, I have Dr. Lisa Simpson. She is the President and CEO of AcademyHealth, which is the organizing body and brains behind Health Datapalooza. So it's a pleasure to have you.
It's great to be here. Thank you, Jessica.
So give everybody a little bit of an intro on AcademyHealth, because I'm not sure if everybody understands exactly everything that you guys do beyond the Palooza. So give me a little background.
So easy answer is we are the organization that represents and works on what we call health services research.
Okay.
Now, so a lot
What
of
does
people.
that mean?
Yeah, exactly. A lot of people are like, huh?
What?
Okay. So that's basically the research that asks questions about what works in healthcare, for which patients, which communities, how much does it cost, and how do we get other people to do it?
Okay.
And so it's all about not research on the human body, but on the care system.
Okay.
And that's what we do. So we're all about evidence, about what works in healthcare so we can make health better and improve the performance of the health system. So that's our job.
That's your job. And then that all comes down to data, pretty much, right?
Well, we like to say, my staff have heard it so many times, data is the lifeblood of research. And now, data is also the lifeblood of transformation, of the future potential of achieving better health and better healthcare performance. And so it was just a natural, we've been involved in Datapalooza since the beginning, programmatically, but we became the host organization 3 years ago.
Okay.
And it perfectly aligns because it's all about data changing the ecosystem and making care better. So we got to understand which of those changes are actually good. Like, understand the consequences, the impact,
Yep.
and where it's not good. Because some
Okay.
changes are not going to be good, and we got to study that.
Talk to me a little bit more about that, because you're like a data expert here, but like a systemic level in healthcare, that's pretty cool. So give me from a macro view, like an analyst perspective, what's changing for the good in data, and then we'll ask you about the bad after.
So the good is there's more and more of it, and it's more and more available, and part of the Datapalooza is all about the partnership with the public sector.
Yep.
Because we, like Todd Park says, we got to liberate the data, data liberación. And so we are totally committed to that vision of transparent and accessible data.
Right.
Now, we've made progress there, talked about not so great.
Yeah.
Usable data, we're not there yet.
Okay.
So not for apps and consumers or transparency that way, but also not for research. Just because you have this treasure trove of electronic health record data doesn't mean it's actually computable in a way that you can get insights and research and findings out of in real time that can actually feed right back into care improvement. So I think we still have a ways to go on that, and that's part of what we do is we're trying to help also, there's new methods. Everybody here, we've been talking a lot about blockchain and, machine learning. And, when you get below the hype, it's understanding what methods, which approaches, AI, et cetera, are appropriate for what kinds of questions. And so that's kind of where we focus our effort is not just in making sure our members, because we have almost 4,000 around the country,
right.
but our members and our partners know where the cutting edge of the methodologies are to actually use the data in productive ways.
And that's one of the things I feel like I hear over and over again about what's so different about Health Datapalooza is the conversation around okay, how do we take this and actually make it usable? What's the philosophy behind it? So talk a little bit more about that, I guess, about the conversation here at this meeting and the conversation that AcademyHealth helps drive.
Yeah, so a couple things that we're really proud of with Datapalooza that we really try, that we think distinguishes it, in the sort of sea of data-related conferences that you go to, that lots of us go to. Well, the first thing is what I mentioned earlier. It's really about the public-private partnership and understanding and really pushing that to make progress, we have to align those two. It's not just one or the other. And sometimes they have to push on each other, so it's a bit of tension, but we got to break through that productive tension for progress. So that's one thing. The second thing is including patients.
Yeah.
We are super proud that, for the third year in a row, we're patients included. We thanks to our supporters and partners, we've got patient scholarships, and so really making sure that voice is at the table. And it's kind of personal for me too, because I'm a now 17-year breast cancer survivor.
Okay.
So that patient experience, and even though I had access to everything,
Yeah.
it wasn't all good
No.
in terms of the actual experience. So
Right.
I get it. And then the third thing is that we're really bringing together, like you say, not just one sector in the data ecosystem, but all of those sectors to dialogue, to touch on the hard stuff. Like there's a panel going on right now on the opioid crisis
Right.
and the opioid epidemic. That's going to take all of us to work together, and data is going to be fundamental. But it's got to be data that users, clinicians, and others can use to really try to, overcome this epidemic and,
Right.
and stop it. So those are some of the things that get me excited about the conversation here.
Yeah. Talk to me about how people can get involved. So, I mean, obviously they can come to the conference, but there's got to be other things. I mean, Academy Health is a big organization. You guys do a lot of different things. So give us a little bit of a, how do people get in? How do people
this
help you guys
conference,
out?
so first of all, like I mentioned, we have our 4,000 members,
Yep.
and this is one of 4 major anchor events that we do around the year. So
Okay.
it's not our biggest. We're coming up in June to our annual research meeting. So that's where really all the folks who are toiling on the data and producing research
Yep.
come together. Well, we might reach 3,000 at that meeting.
Wow,
So it's
okay.
a big meeting. So, and we have 2 other meetings. I won't go into those. But then more importantly, we spend a lot of our time not just helping people produce the insights and the evidence from the data, but actually trying to get it into the hands of people who make decisions.
Okay.
So we work with federal policymakers, we work with state policymakers, and then we work with leaders in health systems. So that's a big part of our work as well, is
Right.
that translation
Okay.
and implementation focus. So for example, one concrete program we have is that we partner with the Medicaid medical directors. So not
Okay.
the political appointee Medicaid director, but the physician, the most senior physician in the Medicaid program, because they want to know, how do I manage my population?
Right.
I've got to control costs, but I want the best possible outcomes for a very vulnerable population with often chronic illness, behavioral health needs, et cetera. So that's a great partnership because you're really talking to the decision maker about what's working, what's not,
Right.
what's the latest evidence. Like, for example, there was a great study that just came out this year building on prior work from the Oregon health insurance experiment that we've all heard a lot about,
Yeah.
but further evidence about the impact of Medicaid coverage on mental health conditions.
Yeah.
How it reduced the unmet need, it improved symptoms, it got folks into treatment. And so it's that kind of evidence that then the policymakers need if they're going to actually support continued Medicaid programs for the vulnerable. So that's kind of some of the other work that we
you guys
do.
are doing. So how does somebody know, yeah, I should be a member of this? Like,
Yeah.
who's give me a profile here, so you watching can just go and hit up the website and sign up.
So we're I'm a pediatrician by training. So my pediatrics group, they're all pediatricians practically,
Yeah.
okay? We're not like that.
No,
we're
it's
the
diverse.
opposite of that. We're so multi-sector and multidisciplinary.
Okay.
And like I said, we're not just about the people who crunch the data and use and make the findings. We're about using them as well. So if you're interested in the new data, you come to Academy Health, you come to this meeting, but then we have webinars and we have other programs, and we have a methods and data council.
Okay.
And the other part we do is we also do advocacy. So we advocate not for other things except for research and data. We want more research, more data availability. So that's really in our swim lane. If you're also interested in application, then you join because you want to work with others like you. That's a lot of sort of bringing together people like me, like those Medicaid medical directors,
Yep.
to be more efficient and learn from each other and sort of, I've been in this for a couple decades, more than a couple, and, I get frustrated that we haven't made more progress faster. So a lot of our work is about accelerating improvement, making, helping people shortcut their, you made those mistakes, I don't want to make those. So those are some other lessons.
All right, last question for you. So what are you most looking forward to, I guess, in the coming years ahead here? Give me the next 3-5 years. What are you most excited about?
Really trying to make healthcare better.
Yeah.
There's a lot of disruption happening now, and if we don't learn what of that disruption is for the good of patients and for communities, people are going to be hurt. And so, that's what I think our role is helping to sort of understand the signal in the noise and to sort of understand where we need to go to help
Okay.
sort of guide folks towards better care, better health. So that's what gets me excited.
Awesome. Well, thank you so much for talking with me, Lisa. It's a pleasure to speak with you.
Thank you.
No problem. So thanks, everybody, for watching. This is Jessica DaMassa at Health Datapalooza with Dr. Lisa Simpson. Thanks.